Thank you for coming. This is a big day, a big announcement for us. I'm very excited to have the opportunity to be in front of you today. I'm Dr. John Jeter, the President and CEO of Hayes Medical Center. Part of the mission of Hayes Med is to provide the best and compassionate care, help communities understand and improve their health using physicians, local hospitals, and other healthcare providers. Our goal is to provide the kind of help for communities so that they can be and stay healthy. As we've evaluated other healthcare providers who share this mission with us, we began talking with the University of Kansas Hospital. Our organizations share many of the same values, and both have cultures focused on patient outcomes and providing exceptional clinical care. About 3 years ago, our organizations met, and we had a chance to work through an award from the federal government. This led to the formation of the Kansas Heart and Stroke Collaborative, a fairly significant project funded by the feds, an innovative program to improve patient care in western Kansas. This collaborative brought Hayes Med and the University of Kansas together, along with 15 critical access hospitals, to improve health outcomes for western Kansas for people with heart disease and strokes. Throughout this important project, our physicians, leaders, and staff have worked exceptionally well as one team. We didn't know the folks at KU that well. Our physicians, our staff. This was a great project to introduce us to the fine work and the people that they have in Kansas City. Organizations demonstrated we can improve the health of Kansans by working together. As a result, we are announcing this morning Hayes Med and the University of Kansas Hospital have signed a letter of intent to form a partnership which we believe will expand our efforts to benefit even more patients. This same announcement is being made in Kansas City, Kansas right now. It allows Hayes Med to take patient care and quality to a level that we could not accomplish by ourselves. This partnership will bring together the best and the brightest healthcare thought leaders to transform the delivery of healthcare throughout Kansas. We will work together to bring more access to specialized care through new technology, recruit new providers to underserved areas, and share best practices to improve care outcomes. This partnership's work will be directed by an operations council made up of members from both organizations. Bob Page will continue as president and CEO of the University of Kansas Hospital, and I will continue as the CEO of Hayes Medical Center. The Hayes Medical Center Board of Directors will remain in place, as will the University of Kansas Hospital Authority Board. The University of Kansas Hospital will provide 2 members to the Hayes Board. Staff will continue to be employed by their current organizations. Both of us are currently in solid financial and operating condition and are coming together at a time of strength for both. Our organizations will work collaboratively and strategically, investing in resources to keep patients close to home for their care when possible, and ensure a coordinated transfer to the appropriate hospital when a higher level of care is needed. As I said, we've signed a letter of intent. We'll spend the next few months working through additional details of the partnership and plan to execute our agreement in early 2017. Working together, patients will see leading-edge medical developments, those that are available only in academic medical centers, come to western Kansas more quickly. But there should be no doubt this partnership will be laser-focused on improving the health of the people of Kansas. We have enormously talented and committed people throughout our 2 organizations. Now we are working to finalize the best structure to provide the most positive impact on patient care in Kansas. I'll be happy to answer any questions. Would also like to note that we will be posting frequently asked questions, FAQs, on our website that will probably help many of you, not only in the room but in the community, answer some of the most pressing questions or concerns that you may have. So thank you. So I'll be happy to answer any questions.
I'll ask a question, Dr. Jeter. How specifically will this benefit a patient at Hayes Med? If you could sort of give an example of how this will benefit patients here.
Question is, how will this benefit a patient here in Hayes Med? And I think we need to think about this from several different perspectives. Short-term, maybe mid-term, 2 to 5 years out, and even longer term, 10 years out. I think in a short term, within the next year or two, we're going to start to see some of these leading edge developments that happen again at an academic medical center like KU come to Hayes more quickly than they might otherwise. Most medical discoveries, new procedures in the operating room, new protocols for chemotherapy or other treatments develop at academic medical centers. It takes time for those to filter out to community hospitals and to the rest of the world. Because we'll be so closely attached, they're going to filter here much more quickly. So I think we ought to be able to provide more cutting edge technology much quicker here in the next couple of years. Of course, we're hoping that the ability to recruit physicians from the University of Kansas Hospital and its training programs will improve. We clearly need to recruit more physician specialists who are, for the most part, trained in Kansas City. Yes, there are some physicians who train in Wichita. There's a family medicine training program in Salina, but some of the specialists that we're really in need of bringing to Western Kansas are in Kansas City. We hope this is going to help us with recruiting. It should help us with retention. It should help us with just our brand, just the overall perception of the care at Hayes Med, and I think that will provide us with additional resources, not only from Kansas City, but even from some of our partner hospitals in the region. So I think patients are going to see an impact fairly quickly. Over the 2 to 5 year period of time, as we grow and we are able to perhaps add more services to our menu of services that we have, patients will be able to get care closer to home that they have to travel today. 10 years and beyond, my hope for patients here is that we'll continue to be relevant. There's a concern nationally that healthcare is changing so quickly, and it's not real clear what it will look like in 10, 15, 20 years. This is probably the best opportunity we have to make sure that this institution continues to be relevant in Hayes and in the region. It's a very important entity to have out here for patients, for the economy of the region, and I think long-term patients and community members will see us continue to be relevant.
Dr. Jeter, this may be very elementary, but in the past, when patients had to be moved, airlifted, we took them to Wichita. Will that change?
The question relates to where our patient's going to go that we can't take care of. It's always up to the patient and the family and their advisors where they go for care. There is no doubt that this relationship is going to strengthen the ties between us and the University of Kansas Hospital so that transfers to Kansas City will be more seamless, more organized. I think our physicians, as they develop better relationships, and some have great relationships today with the physicians, the University of Kansas physicians in Kansas City, as those relationships even improve, I think our doctors are going to be more likely to recommend transfer to Kansas City, but only when the patient agrees to it. And I will say that we have to solve certain transportation issues related to reimbursement for patients that are transported from here to Kansas City. So that's a known problem that we have had. Our doctors in the last several years have started transferring more and more patients to KU Hospital. Honestly, the University of Kansas Hospital is a great hospital. It's bigger than we are. It's a little harder to get to. It's a huge complex. There's a lot of cranes, but it's a fantastic place to get care that we can't provide. I think most of us here would be very comfortable going there for care. There's a few things that we still do send to Wichita today, and that won't necessarily change.
Will there be opportunities for patients to take part in more clinical trials like they do at the Cancer Institute right now?
Great question. Will our patients here have more opportunities to take part in clinical trials? And I think the answer is yes. There's no question that the potential for this relationship is enormous. And again, to emphasize, we've signed a letter of intent. We now have many, many more meetings and get-togethers between our staff and management teams and our boards to try to figure out what can we do with this, but the potential is just enormous. And I'm pretty confident that, as I said, some of the new developments and techniques that they're developing in Kansas City will come to us much quicker than they would ordinarily, particularly in cancer.
John, is there a potential for the system to grow beyond the initial 2 members?
Question is whether the system will grow. Right now, the system, and again, we will be officially in the system as of the end of the day, December 31st. The system right now includes the University of Kansas Hospital and its physicians, University of Kansas physicians. So we'll be the second hospital. And the potential is to grow. Additional hospitals, additional physician groups. We haven't had any conversations related to this announcement because we've been working hard to put this together. But tomorrow starts the annual Kansas Hospital Association convention in Kansas City. And I suspect there'll be some conversations about what is this that we've done, what's it all about. So I think Bob Page and I, my peer in Kansas City, are very excited to have some of those conversations. We'll see. That's not the most important thing to consider today. Right now, we got to put together what we have. We've got our hands full with this project.
Is there going to be more people coming from KU to hear specialists, or are they going to be sent east, or is that going to change that?
Yeah, question about whether physicians from the University of Kansas Physician Group, part of the system, will come here to do clinics or perhaps to do surgeries. And I think the answer is yes. We already have some from Kansas City that are coming to Hayes, and there's no doubt we'll be one of their partners. And I think the whole mentality of the relationships are going to change. They announced this to their physicians and their senior management team yesterday in Kansas City, and apparently the level of enthusiasm there is pretty high. I mean, there's been lots of rumors there and here, over the last couple of years. But now that this is official, I think everybody's starting to get excited. And I think it's going to be much easier to get some physicians in specialties where we've really struggled here to come out to Hayes to do some clinics. This will hopefully be one of their preferred outreach sites because it's a partner hospital. So I think we're pretty enthusiastic about the opportunities. Dr. Carlson, who asked the question, was a retired orthopedic surgeon and had a practice here in Hayes for many years. I think you trained at KU, did you not? Our orthopedic surgeons today don't know any of the orthopedic surgeons at KU Hospital. And as an example, they're very excited to get to know their peers in Kansas City so they can kind of share best practices and how do you guys do this and how do you guys do this and what are some of the complexities of practicing orthopedic surgery in an urban community versus a rural community. What are some of the challenges that we have? And the opportunity for people to sit in a room and talk and compare notes and develop best practices is really how we're going to, in a nutshell, improve the care for Kansans that enter the system for any kind of specialty. It's going to take a few years, but I think we're really excited about that.
Sorry, for a second question. Do you see this changing or enhancing our relationship with the small rural hospitals in our area?
Well, we hope that it enhances the relationship. Anything that clinically that benefits us is going to be passed along to all of our other partner hospitals in the area, particularly Pawnee Valley Community Hospital in Larned, where we have a very close relationship and basically are responsible for operating that facility. So anything that comes here to help us will immediately help them. Other hospitals in the area where our affiliation is a little looser will have opportunities to participate as many things as we can. We've got a lot of issues to work through, but I think we're really hopeful that eventually this is going to benefit anybody out here who wants to be involved.
I know a number of people who go to Plainville. So, yeah.
Sure. Plainville is one of the hospitals that we work with. Plainville is on our information system right now. The potential here is just enormous.
Peter, do you see it trickling down to some of the other departments as far as like with respiratory and nursing and all with best practices?
I love this question. Is there going to be a trickle-down effect? And the answer is absolutely yes.
Because I'm an active member of ANA, American Nurses Association, and magnet status would be awesome.
There's some things that KU does There are some recognitions that they have, frankly, that we covet. And one is magnet recognition by the American Nurses Association. The KU is the first magnet hospital in the state. They're going to help us achieve magnet status. We think we function really much like a magnet hospital, which a magnet is a designation that is highly prized by nurses. And it would be an advantage for us to have magnet recognition. We think we function like a magnet hospital, but we just haven't quite figured out how to get the accreditation, and they're going to help us. And there's many other examples of trickle down where we're going to put our groups with their groups. And we were talking in human resources, about various things that they do versus things that we do. And you know what? They're new at this too. They've not had another hospital in their system. So this is new for them, and they're just as excited and enthusiastic about this as we are. There's a lot of people in Kansas City, as you all know, that have roots in Western Kansas, that are from Western Kansas. Many of their senior leaders at the University of Kansas Hospital are from Hays and Brooks County and this area. So that's one reason why I think they're really excited to be involved with us. There's just a ton of great people that we have met in our experiences with the folks at the University of Kansas Hospital. So the trickle down is going to be alive and well everywhere in the organization. And it may go the other way too. It is actually possible that there are things that we do and know that they don't, particularly when it comes to rural healthcare, which they're not experts on. They're experts on academic medical care, metro care, which we're not. So the combination of that is really potentially powerful.
Do you anticipate that this partnership will bring about any physical growth to the hospital, any new physical construction added on, new departments or so on?
Will the partnership result in any hospital enlargement, expansion? I think it will, actually. I think as we grow, particularly some of our higher level, higher end services here, that we will need to do some expansion. Now, fortunately, we've been planning for that all along, and most of it would be inside the existing four walls. We have a lot of shelved space in the hospital right now that we will potentially fill out if certain things happen the way we'd like them to. So I do think that this will result in some hospital growth. I will be disappointed if in 5 years we aren't providing more services, and it would be surprising to me if we aren't employing more people in 5 years than we are today. But I hesitate a little bit because healthcare is such a crazy dynamic industry right now in the United States that it's a little hard to predict. Everybody's having trouble predicting what's going to happen with healthcare. We spend way too much money on healthcare in the United States. We probably do too many procedures on people in the United States. We prescribe too much medication. Baby boomers are getting a little healthier, perhaps, than some of the older generations. Smoking is going down. Exercise is improving. Obesity is probably reducing a little bit. And who knows how that will impact the demands for healthcare in the future. We're all paying a little more out of pocket than we have been. We're making wiser decisions as consumers, and all this has an effect on the growth of healthcare, which is one reason why this relationship is so important to us. Because in 5, 10, 15 years, when things have really started to change, we think it's important to be tied to somebody to make sure we're still relevant. I do want to point out that one of the things important to our board is that we affiliated with a Kansas-based company. And the KU Hospital is not a state entity. It's not part of the Board of Regents. It's a separate private entity. But it is a Kansas-based corporation. And most of the other health systems that are present in Kansas have their headquarters elsewhere. In fact, all of the major ones do. And so this was really a great opportunity to partner with a Kansas-based system. Their board of directors are for the most part, Kansans. They are very dedicated to healthcare in Kansas. And you'll notice I have a purple tie on. This is not the University of Kansas that this relationship is with. It is the University of Kansas Hospital, which is separate from the university. And again, we think it's the best hospital in the state. It's certainly the best hospital for us to be affiliated with, and we're really happy that it's a Kansas-based company. Again, there are FAQs that will be, if they aren't already, posted on our website that answer a lot of other questions that haven't been asked. But I'll be happy to answer more.
Will there be any change or addition to the Hayes Med to reflect?
Oh, great question. What are we going to do with our name? You know, we aren't sure yet. We believe that we'll continue to do business as Hayes Med. Our official name is Hayes Medical Center, Inc., and we do business as Hayes Med. We think we'll continue to do business as Hayes Med, probably with something like part of the University of Kansas health system. We were just having a debate about, are we going to think about our stylized logo? Will we change that? Will the system have its own logo? Because the University of Kansas health system doesn't really have a particular logo that I'm aware of. So I don't know yet. Some of this stuff is still in discussion. I believe that in the latter part of January, we'll probably have our arms around all the branding, and we'll be able to be more specific. But at this point, the intent is that we will continue to do business as Hayes Med, part of the University of Kansas health system. We are proud of our name. We think we have a good reputation. We want to keep it, and that is part of the agreement. Appreciate you all coming. Thank you.